I'm going to talk about the elbow. So the elbow joint is two articulations. It's the distal humerus and then the proximal parts of the radius and the ulna. And then it's also, there's two joints of the radius and the ulna, the proximal radial ulnar joint and the distal radial ulnar joint. So on the, for the joints of the actual elbow, you have the convex trochlea of the humerus, and that articulates with the concave trochlear notch of the ulna, and then you have the convex capitulum of the humerus articulating with the fovea of the radial head. And so at the elbow joint, that's flexion and extension, that's a sagittal plane movement with a medial lateral axis. Those are the only movements available at those two joints. The majority of the joint stability actually comes from the humeral ulnar joint. Now for the proximal radial ulnar and distal radial ulnar joints, at the distal radial ulnar joint, that's going to be the concave radial notch moving over the convex ulnar head. And at the proximal radial ulnar joint, it's a very tight connection. There's just a little bit of rotation that happens between the convex radial head and then the ulnar notch on the ulna. Also, when you have movement at this proximal radial ulnar joint, you also have a bit of a spin at the radial humeral joint, because that movement all goes together. Movements at the proximal and distal radial ulnar joint, that's pronation and supination. So pronation, palms down, supination, palms up. You'll notice if you kind of do them in the anatomical position that pronation kind of goes with internal rotation and supination with external rotation. And pronation and supination is a rotary movement. It's in the horizontal plane with a vertical axis. So those are the joints of the elbow. And notice for pronation and supination, that features the radius moving over the ulna, and that's important because when we talk about the muscles, for a muscle to pronate or supinate, it must attach to the radius. Okay, so for a muscle to pronate or supinate, it must attach to the radius because the radius has to move over the ulna. So going over the muscles of the elbow, we have the biceps and the triceps, which also are muscles of the shoulder. The biceps attaches from the supraglenoid tubercle of the glenoid fossa. It's going to attach to what we call the bicipital aponeurosis, which is just kind of a tendinous insertion over here, and then the radial tuberosity as well. And of course the biceps is an elbow flexor. It's also a shoulder flexor. It is also a supinator, and it's the most powerful supinator. And the nerve is muscle cutaneous. The brachialis muscle comes from about the middle of the anterior shaft of the humerus, and is going to attach to the tuberosity and coracoid process of the ulna, and it's probably the most powerful elbow flexor, and its nerve is also muscle cutaneous. And because it attaches to the ulna and not the radius, its force is not changed by the position of the forearm, whereas for the biceps is really only strong in a supinated position. And you'll notice on yourself, if you flex in a pronated position, that's not your biceps, it's actually your brachialis muscle. The brachioradialis muscle comes from the lateral supracondylar ridge of the humerus, and it's going to insert onto the styloid process of the radius. So it comes right down, otherwise known as the beer drinking muscle. So it's the muscle that comes right up on the lateral side. It's an elbow flexor, and it can pronate or supinate depending on the position of the forearm. And its nerve is the radial nerve. Moving to the posterior side, you have the triceps. The triceps muscle it has three heads, and the long head comes from the infraglenoid tubercle of the glenoid fossa. The lateral head comes from the posterior proximal half of the humerus. The medial head comes from the posterior distal half of the humerus, and they all insert onto the olecranon of the ulna. And the triceps the long head only is an extensor of the glenohumeral joint. It can also adduct to the glenohumeral joint, and the lateral and the medial head will extend the elbow, as well as the long head of the triceps. What's important to remember about the triceps is that these heads are recruited in a very particular kind of way. So if you're using your elbow extensors maximally, they'll all be recruited. But for anything submaximal, it always goes medial, lateral, and then the long head is only recruited for really maximal activities. The other elbow extensor you have is the anconeus muscle, and that's going to come from the lateral epicondyle of the humerus, and then to the lequinone process and the lateral shaft of the ulna. It extends the elbow and actually is the muscle of choice when you have a very low level activity. So a lot of very low level extension activities that you do every day, the anconeus is going to get recruited first. And the triceps and the anconeus, as well as the whole posterior part of your arm, are all radial nerve. Okay, so posterior part of the arm is always radial nerve. So there's a couple other smaller muscles that we talk about when we talk about the forearm. There's the pronator teres, and the pronator teres comes from the medial epicondyle, the common flexor tendon, and then epicondyle, common flexor tendon, what's the other one? And another one. And it goes to, I think it's a coronary process of the ulna, sorry. And it goes to the proximal lateral part of the radius, and it pronates the forearm. It can flex, but it's a pretty weak flexor, and its nerve is the median nerve. Pronator quadratus comes from the anterior distal medial part of the ulna and attaches to the anterior distal lateral part of the radius. And it's just a pronator. So it actually looks kind of like a square, hence the name quadratus. And its nerve is median. And then the supinator muscle comes from the supinator crest of the ulna. It comes from the radial collateral ligament and the ulnar ligament, and then comes to the lateral edge of the radius, and it supinates, and its nerve is radial. And those are the muscles of the forearm and the elbow.